Hello, everyone. Welcome to this town hall about how can I trust the COVID-19 vaccines, what every young adult should know. My name is Allison Caban Holt, and I'm the Associate Director of the Maya Angelou Center for Health Equity at Wake Forest School of Medicine in Winston-Salem, North Carolina, and I am the moderator for this evening's session. We are excited to bring this town hall to you to have a frank and informative conversation about the COVID vaccines. We particularly want to reach younger adults who are in the decision making process about whether or not to take the vaccine. We want to equip you with reliable, accurate, and up-to-date information that you will need to make a decision for yourself and your family. Right now, there are numerous sources of information that you can tap into 24/7. Some of those sources may have misinformation. We have gathered for this town hall experts in research and medicine who will share current knowledge about COVID and the vaccines. We also have community panelists who have been at different stages of the decision-making process around the vaccines and who will discuss their personal experiences of COVID and the vaccines. This is an opportunity for you to ask the pressing questions that are on your mind and to address any COVID or vaccine concerns you may have. As we go along, feel free to share your questions in the chat, and we will try to address as many of them as we can during the question and answer session. Now, I would like to introduce you to the panelists for this session. Dr. Goldie Bird is a professor and researcher with expertise in genetics. She is also the director of the Maya Angelou Center for Health Equity at Wake Forest School of Medicine. Dr. Jensen Hall is a researcher and assistant professor of medicine and a member of the Molecular Physiology Institute at Duke University School of Medicine. Melissa Funderburk holds an MBA and a Master's of Organizational Management and Project Management and is the Healthier Together Operations Manager for Region 3 of the North Carolina Counts Coalition. Timothy B. Peters is a major in the U.S. Army and holds a Master's in Public Health and is an executive and has an executive MBA degree. Latanya Yarber is a support associate at the Maya Angelou Center for Health Equity at Wake Forest School of Medicine and is pursuing her Master's in Business Administration. And Honesty Gainey is a recent graduate with her Bachelor of Science from Winston-Salem State University, and she is currently in training to become an emergency medical technician. And I thank all of our panelists for being here. We will briefly hear from all of the panelists, starting with Dr. Goldie Bird.
All right, am I there? And, can't remember what I'm supposed to do here to share this slideshow. There we go. Can everyone see that? Display settings. All right, I think we're here. Thank you, Dr. Caban-Holt, for your introduction, and good evening, everyone. I'm so happy to be here this afternoon and to share this with our COVID Community Research Partnership Council that has been very, very instrumental in the work that we've done at the Maya Angelou Center for Health Equity and COVID, as well as our COVID Community Research Partnership. We're just delighted to have all of the young people on the panel. We're happy to, I'm just very honored to be here with Dr. Hall, as well as all of the young people today, because we want to share some things with you and give you some information we want you to know. We want to clarify some of the misconceptions that people have about this virus and this vaccine. And we want everybody to go away much more knowledgeable and much more able to make good decisions about the vaccine. So let's just go. I have about 10 minutes to talk about the pandemic and the disparities and mistrust that it has engendered, testing, contact tracing and studies, and the importance of participation. I'm going to talk about the vaccine, and I don't like to use hesitancy so much now. As a matter of fact, I think the terminology is changing a little bit because maybe it's more deliberation than it is hesitancy. And then a little bit more about misinformation and what misinformation can do to us. And then, of course, a little bit about lessons learned and next steps. So again, it's been quite a few days and weeks now that we've been involved with this coronavirus pandemic. And as much as we all would like to start doing everything we want to do, we are still in the middle of a pandemic. It is still costing lives every day. It's wreaking havoc on families, not nearly as many, but we're still in a very prickly situation with this pandemic. One of the things about the pandemic is that it illuminated longstanding disparities and inequities in communities of color. I think everybody on this call tonight and our listening audience is aware that it has created havoc in the Black and brown and red communities disproportionately. In the midst of the pandemic, we had Black Lives Matter, and then later we had an election, and we've just been stressed out for many months now. We've had a very hard year, a year and a half now, almost a year and a half of just a lot of stress that has really burdened communities of color and done some of everything within our own bodies, even if we were healthy. Some of the outcomes, we've lost wages and jobs and businesses. Thank goodness we're able to get a job now. Everybody's looking for people to hire. We've lost loved ones, and we've had educational loss. We've had social isolation, mental health, anxiety, depression, and even in the news nowadays, you're hearing that there's a lot more mental health issues than there were, a lot more deaths, a lot more dying, a lot more violence. And so we've really suffered over the last year and a half. And not only did people die and disproportionately and get infected and hospitalized and on ventilators and all that business and die, and now we're hearing people say that there are consequences, the long-term consequences of being infected with the coronavirus. And so long after many of the virus, many people are still sick. They're getting these brain fogs and mental effects and physical effects from having the virus. And what we're finding is that when people take the vaccine, some of the signs and symptoms actually go away. And I'm not going to stress on that because Dr. Hall is on the call, and it's always great to have an MD on the call when we're doing these things. So African Americans, as we said, make up one of those groups that are overrepresented in COVID-related infections, hospitalizations, and deaths here in the United States. And now over 600,000 people have died from this, from the effects of this virus. So communities of color were more likely to suffer those social determinants of health. And again, and of course, those things really predisposed us for infections and hospitalizations and deaths and dying. Just along those lines, I was asked to talk a little bit about why these things are happening in communities of color. Well, first of all, let me just say that even when there was no COVID, the life expectancy by race and ethnicity in the United States is different. So if you look at the green line, that's at the top, those are the Asian and Pacific Islanders. The purple line is all of us, and so that's like the middle. That orange line, as you can see at the bottom, those are Black folks. So our life expectancy is shorter than anyone else. And of course, African American male life expectancy is the lowest. So when you look at what causes that in general, and then we'll talk about what causes some of the hesitancy that we might have. But this is a slide that I like to use just to show the differences in the way people live. If you look at Buena Vista in Winston-Salem, which is a very rich area, and you look at Boston Thurman, which is a not so rich area, the life expectancy difference is 12 years. 12 years with two parts of town that are just 2.5 miles apart. And what we are learning now is that the way we live, our neighborhoods, those social determinants or social drivers of health also predict our life expectancy and our health expectancy, and therefore our susceptibility to disease, death, and dying. So if we just look at what happened with COVID, what we found is that even with a lower life expectancy among some of these populations, in addition to that, COVID took off more years of life expectancy for Black people than it did for white people. So let's just talk about then what we call that is these are disparities, these are health disparities. And what we want to get to is health equity. Now, when we look at what has precipitated a lack of health equity. What I want you to see in this slide is that African American citizenship status and health experiences kind of jive. So if you look at the time span between when we came over as slaves and where we are now, 85% of our time we were really we were either owned or we were dehumanized, and we had these structural or systemic racial things that have caused a difference in the way we actually live now. Those things reverberate years and years later. And so when we think about why we may be hesitant about a vaccine or about a research study, all of these things that have led up to now are, quite frankly, they do influence our decisions. And so we don't want to ever forget that. So we have these other things like eugenics in North Carolina that says that people could be sterilized even without their approval if someone felt that they were in some way less than. So things like that, people remember between 1929 and 1979. That hasn't been that long ago. And then most of us remember the Tuskegee syphilis study from 1932 to 1972, which is the largest federal health study that really discriminated against people. And in this case, they're African American males who were denied treatment. And so these kinds of things sort of, and they haven't been that long ago. So the young people on the call may not remember these, but your parents certainly do. And so these fears and then things that are happening now, where we don't maybe trust the government, or we don't trust our environment, our policemen. We've heard a lot about that in the last few months since George Floyd's death. So all of these things actually create distrust and mistrust among us. In addition to the fact that we know that when we go to the doctor, we're not always treated the same. So all of these things accumulate and they weather us and they burden us. And some people actually thought that perhaps because of all of these things that we're talking about tonight, this vaccine or this or being tested or being contact traced would sort of fall into these categories of things that are unfair, things that are biased. And so that's why we need to have a conversation like this one tonight. So before I try to encourage everyone to be healthy, I just want to say a few words about the vaccine itself. There's a lot of misinformation about the vaccine and what it is. Well, when you have a vaccine such as the COVID vaccine, they are RNA viruses, and so I know all of us have heard of DNA and genes and all of that, but RNA is similar to DNA, but and they encode a protein. In this case, when you see to the right of this slide, the circle with the little red spikes on it, the RNA makes those proteins on that virus, on the SARS virus. The SARS-CoV-2 is the virus that causes COVID. And so the RNA is only there in the vaccine. It's only there to make that protein on the virus. It is not a whole virus. There is no chip in the vaccine. It's just that mRNA. There's some salts there. There's some lipids there to help it get through membranes, but there is no chip there. There is no DNA in there that can get intercalated into your DNA and we start growing horns and things like that. There's nothing in that vaccine that would cause you to get sick as far as we know, except in just a few cases, and we'll talk about those. So what happens is the vaccine gets injected into your muscle, and then the vaccine itself triggers the production of a protein that's on the virus, so that your body begins to make antibodies against the spike protein mRNA. Okay, so you are making protein in the body. Our body's immune systems fight that protein. So there's not a whole, unlike some vaccines, there's not a whole virus. There is no chip. There is nothing there, as we know today, that can cause a lot of problems for us. So then who's being vaccinated? Today, about 80% of those 65 and older are partially vaccinated at least. 38% of those between 18 and 29. And then about 25% say of 18 to 39-year-olds say they will likely or probably not get vaccinated. This creates a problem as we think about variants. If not enough people in our communities get vaccinated, then we get more variants that we've talked about. In this particular study that was reported in the Morbidity and Mortality Weekly Report, that the groups of people who they say are not being vaccinated are Blacks, low income, lack health insurance, lived outside of metropolitan areas, or low levels of education. Now we know that that's not always the case, but those are the predominant groups. So when we think about variants, we heard a lot about these three, the UK, the South African, and the Brazilian. But now we're talking about, you're hearing quite a bit on the news about the Delta variant. So what causes a variant? And basically, when there is a change in the mRNA of a virus, we get something that looks different. And when there is not enough vaccinations, when there are not enough vaccinations in the communities, in our society, that virus has a higher chance of changing, of mutating. And so when the mutations come, we get changes in the phenotype, if you will, or the changes in the way the virus acts. So in these cases, the viruses are much more deadly. They may much more easily get into our systems. They may be much more readily to kill us or to make us very, very sick. And that's what we're seeing with the Delta variant. Is much more likely, we're much more likely to get it if we haven't been vaccinated, and we're much more likely to get sicker if we get that particular variant. So again, you can just sort of see the little pictorial here. So when the viruses change, and it's kind of sort of depicted here on the right with the different colors. So the different, and the Delta one is not there. But when these viruses change their mRNA, they actually get more dangerous. And the longer they stay out into the community, the more likely that virus is to change. The thing about this mRNA is it's a single ribbon, a single strand. DNA is double-stranded, so it's less likely to mutate. But mRNA, which this virus has mRNA instead of DNA, they're much more likely to change. So we're likely, unless our communities do a much better job of getting more of us vaccinated, we're going to see more variants, and we're going to see more variants that are more dangerous, and which they more than likely will cause us to have to get boosters and things like that. And we're hoping, as of right now, the vaccines still work against these variants. But it is possible that if the more variants we get, the more dangerous they are, the more unlikely that the current vaccines might work with them. And so we are seeing, we just hearing on the news and reading papers that saying that we might get new, as we get new mutations, new variants, new strains. And as we are becoming, we're actually getting better about the hesitancy. But now we're seeing more relaxed public health guidelines. And so people are feeling freer to go out, to eat, to engage with each other. If we fail to take the precautions that the CDC and the NIH are putting out, and if we fail to get the vaccinations, we could very well get more surges in COVID. So again, as we age and as we go through these social determinants and all of those things that create hesitancy and pause with us, creates the perfect storm for COVID-19 disparities as well. Just to let you know that we are not getting, African Americans are not getting the vaccines the way we were not back in April. We're doing better, actually. And so I'm happy to see that our people are thinking about getting the vaccine in order to be healthy. Just to let you know, though, that the number of vaccines with everybody are plateauing. This was just June 19th, just a couple of days ago. And so as you can see in the light green there, that's everybody. But you can just sort of see how this is plateauing. These people in the dark are just those that are fully vaccinated. As we all know, the Janssen or the Johnson & Johnson only requires one vaccine. And so some people ask us, is this safe? Are the vaccines safe? The 319 million vaccines have been given. 150 million people fully vaccinated, and that's about 45% of our population in the United States fully vaccinated. There have been 3 deaths due to what we has been reported as due to the Johnson and Johnson. We're still looking at the associations between those deaths and the vaccine itself. Some deaths have occurred after vaccinations, not really sure they've been associated, not really sure if the vaccine itself caused those deaths or if something else caused those deaths, but after a vaccination. What we know is that over 605,000 people have died who have not had the vaccine. So I think the odds are pretty good that the vaccine is helping us out. What I want to leave you with today is that when there is a new therapy or a new intervention, if we can assure that it is safe, we want everybody to take advantage of whatever that is. So whether that's a new drug or a new intervention or a new vaccine, we want all populations to be healthy. And it is risky, quite frankly, not to take this vaccine. So tonight we just want to arm you with as much information as we can. We want people to ask good questions. And then also, one good thing about this vaccine is that we've had people of color right in the midst of things. We had a North Carolina scientist who helped develop this vaccine, and we've had all kinds of people of color at every single step of this, of producing this vaccine. So I personally have had mine. My entire family has had its immediate family has had this vaccine, except my 5-year-old grandbaby, and I'm pretty sure mom's going to get that as soon as she's able to. So at the end of the day, we don't want to see these disparities in deaths and infections. We want to see everybody be as healthy as you possibly can. I think that's it. Thank you very much.
Thank you, Dr. Bird. That was a great synopsis about the genetics of the virus and some historical context around this trust. We appreciate that. Next up will be Dr. Jensen Hall.
Oh, can everyone hear me? Okay. Thank you, Dr. Bird. That was an excellent summary. I just want to make sure that I highlight certain points that you raised in that to emphasize how important it is to get vaccinated in order to protect the larger global community. So this is an individual decision, but as you make it, you are making a decision that really impacts your neighbors that are, as close to you as down the street and as far away from you as across the globe. So, I want you to think of your decisions as having that level of consequence. So with every, let's see here. With every talk of this type, I have to mention financial disclosures, nothing more to show than that. But I want you to understand kind of how COVID looks to physicians, providers who give care to patients who've been infected with SARS-CoV-2 and have COVID disease. So the most serious symptoms, because COVID-19 is a respiratory virus, or because SARS-CoV-2 is a respiratory virus, COVID disease manifests mostly in respiratory symptoms. If you remember, Keisha Lance Bottoms, who's the mayor of Atlanta, when she announced that she got COVID, her family got COVID, she actually didn't experience much in the way of respiratory symptoms. They all got really tired and sluggish, and that was as bad as it got, apparently, for them. But that's a rare situation. Most of it is respiratory. So you're going to get things like shortness of breath, cough, difficulty in breathing, easily fatigued, you get winded, that sort of thing. A lot of what you would expect with a really bad cold. But in addition to that, you might also get symptoms of fever, cough, tiredness. things like that. And some of the more defining symptoms for COVID have been the loss of smell and the loss of taste. So once you get those types of symptoms, that is uniquely a signature of having active COVID disease. It doesn't say how bad the disease is going to get necessarily, but it just says that you more likely than not have it. And at that point, you need to approach a physician or some place where they can test you for COVID, so you know, understand what the next few days, weeks, whatever should be like, particularly in terms of your sharing company with people around you. But there are symptoms that go on, and this is what, as more and more cases occur, we're up to 600 and some odd thousand deaths in this country, and millions of cases have happened. And so this is sort of in a crude way of thinking about it, a long-term experiment. We're actually seeing what this infection can do in a population. And beyond the sort of acute symptoms that last a couple weeks and make people miserable, you can also have people who have really bad long-term symptoms, and Dr. Bird alluded to some of these when she mentioned brain fog and heart disease. But the virus has what we call a tropism for cells that express what they call receptors, but these are just places where the virus can attach, and the cells can suck the virus essentially into themselves, and it can, begin its replicative cycle. The issue is that we don't fully understand all of the reasons why the virus can get in the places that it can get, and why in some people it causes these enduring symptoms and not in others. But for those who do have the misfortune to get these long-term symptoms, they can be of enormous consequence to their way of life and their health in general. Fatigue and shortness of breath can endure, but it can affect you neurologically. So the brain fog that was mentioned earlier, and unfortunately, even cardiac symptoms. If you're thinking about, well, I'm not going to take it and just take my chances. If you do get COVID disease, once you have it, there's no way to predict what side of this fence you'll end up on. It could be something really short that just has you miserable for a couple of weeks and then it's over, or it could result in these long-term symptoms. And that's a gamble that you really don't want to make. As it relates to the overall disease, the people that are most at risk are, people who are already carrying some sort of risk, some sort of health risk already. So obviously, if you have heart disease, that's a problem. If you have diabetes, that's a problem. Respiratory trouble, hypertension, cancer, any of those things. And that doesn't usually end up being the biggest set of concerns for people that are younger. But, it can be. Certainly diabetes, obesity, hypertension, those things are showing up more in younger populations than what we had been accustomed to seeing. So it's one of those things that you just have to be conscious of. And even if it's not you, I'm sure that you know someone who has this. So you don't want to be the person that carries this virus to a person that's got this sort of health profile. Because if that's a person that you love and would like to interact with for years to come, this is the type of challenge to their health that could really set them back. So this is where making a decision on the behalf of other people could have significant consequences. So in the way that Dr. Bird alluded, the situation of African Americans in terms of their vaccination acceptance and so on has improved. But still, we have a ways to go. What's certainly very clear is that when you look at the deaths per 100,000 people, a consistent theme has more or less emerged and has maintained over the course of the pandemic to this point. And that is that people of African descent, African Americans, and people of recent African ancestry tend to do worse. And a lot of that has to do with the conditions of living and other sort of socioeconomic factors. However, whether those factors are at play or not, it does seem to be that this type of situation drives disease in the community. So what we really want to do is to protect everyone who can be protected. The only people who shouldn't take the vaccine are people who, for whatever medical reason, can't take it. So if you are African American and you don't have a contraindication or a reason why you can't take the vaccine, you should be taking it. If not only for your own protection, but for the protection of others who may be more vulnerable than you. Okay. So Dr. Bird also talked about some of this, but I'll summarize in some ways that I hope are impactful. How effective are the vaccines? So there are 3 on the market that have the most notoriety: Moderna, Pfizer, and Johnson & Johnson. Moderna was the Moderna vaccine and the Pfizer vaccine are RNA-based therapies, very similar in performance. And as it relates to what they call symptomatic COVID, or, you getting the infection and then getting symptoms of the disease, Pfizer and Moderna perform really well in preventing persons who've been vaccinated with either of them from getting those symptoms. However, the Johnson & Johnson vaccine, and this is not really an apples to apples comparison because this came a lot later in the pandemic than Pfizer and Moderna. It's a different formulation and a different way of delivering sort of a stimulus to the immune system to produce these antibodies to the spike protein, but it also does perform really well. The thing about all 3 of them is all of them prevent you from going and being hospitalized for COVID. Nobody wants that. From dying from COVID and from dying from the vaccine. All 3 of them do the exact same. They perform in the exact same way. So if you get the vaccine, you are preventing the likelihood that you will be hospitalized for COVID, die from COVID, or even die from the vaccine. There's nothing with a guarantee like that. And this is from, large population studies. And the data is still bearing out. So, this is probably months old data at this point, but it still is the case that this level of performance is what you get. So this is where things are now. And I just pulled this down from the CDC website. I didn't have it in the original presentation, but I think it's always helpful to kind of position yourself in time and figure out just what you're dealing with. When it comes to deaths due to COVID, we are actually far enough out from the release of these vaccines to actually be able to say with confidence that the trends that we're seeing, the declines in death, the declines in cases, are due to the fact that we have implemented a solid vaccine rollout strategy and that people are taking shots and getting themselves protected. When people are vaccinated and they have built an immune response against the virus has less places to go to be successful in propagating. So the virus has to find people who aren't vaccinated, who aren't protected, who are still vulnerable in order to infect them and to propagate. I just want to make this point very, very clear. The situation with the Delta virus is a perfect example of what happens when a portion of the population decides, well, I'm just going to wait and see. I'm not going to do it right now. The point is that the more encounters the virus has with human immune systems, the worse the virus is going to be. And that is because viruses, in a way, get educated by the experience they have in fighting an immune system. So if you have 2 viruses and those viruses infect 2 people and the first person's immune system is weak, the virus infects them, propagates, overwhelms that person and kills them, then that person dies with that virus. And if they were more or less isolated in that exposure, then it never got to go anywhere. But if the other virus infects a person that's reasonably healthy, that didn't get vaccinated, and they get infected, and the virus enters that person's body, encounters the immune system, and shuffles the deck on its genetic code so that it can figure out ways to get around the challenges that person's healthy immune system is placing. Some of those viruses will die because the person mounts immune defense, but some of those viruses will pass on. They will make it out of that person and probably move into other people. But those that moved, among those are more educated population of virus that has more capability to spread and infect people. And that's why situations like the Delta virus emerging from India is carrying 2 mutations instead of 1 that make it even more able to spread and transmit between people. So the protection that we're appreciating now is only for a short period of time. It is defined by how much of the population has made the choice to get protected against the viruses that exist right now. And the protection, by the way, is not immediate. It takes a certain amount of time, obviously. But if we all get in the mode of getting vaccinated and suppressing the amount of circulating virus, we could stamp it out. It is possible to do it. And so it's something that you really need to consider in those sort of global terms. All right. So when you get the vaccination, what happens? You will get some common side effects that people get are, pain at the injection site. That's what I got, the second time through. The first time, I really didn't get much of anything. Maybe a little bit of tenderness at the injection site, but not like disabling pain. If you've ever had the tetanus vaccine, it was nothing like that. It was that usually freezes my arm up, but it was more like what you get if you had a flu vaccine. Maybe a little redness and swelling. I didn't get either of those the first time around, but by the second time, I did get a little bit of redness and a little bit of swelling. The first dose for Moderna and Pfizer is your initiation dose, and that's what awakens the immune system to what foreign material that the virus would carry looks like. The second dose that you get is a booster, and that just reawakens the virus after a period of weeks. Reawakens the immune system after a period of weeks to generate more antibodies and a more robust response to the vaccine. So it's meant to kind of give you a 2-staged protective cycle. And, you can get things in the rest of your body: tiredness, headache, muscle pain. If I got anything from the vaccines, it was the tiredness component. But I also have kids, so I guess, who can tell? There's chills, maybe fever. My wife had a little bit of the chills, but not fever or any of the other symptoms. So it just depends. It's different for different people, but this is mostly what you see. So the things you can do to protect yourself, everything that people have been encouraging to do since all of this started back in 2019, hand washing religiously. It's better than squirting the hand sanitizer, because hand sanitizer, all it does is it kills what's on your hands, but those things still remain on your hands. So if you killed any bacteria or viruses, they remain as sort of dead material still on your hands. Washing your hands not only sterilizes them, cleans them, but it removes that debris. Always practice courteous hygiene. Cover your face when you're coughing, sneezing, anything like that. It's good to carry around tissues, not handkerchiefs, guys. You don't want to be reusing the same thing over and over again, but things to just kind of clean up a little bit and then throw them away in an appropriate receptacle that's not kind of open to public exposure. Maintain social distance still. Unless you're vaccinated, you need to be thinking about containing or limiting the possibility for viral particles to spread. It can spread in the fine particles of your upper airway. So if you sneeze, if you cough, if you yell, if you sing, you produce these fine droplets, and the virus can carry in those droplets. So you want to avoid that, and distancing is the best way to do it, particularly if you're indoors. And avoid touching your eyes, nose, and mouth. These are the places actually where the virus gains access to our bodies. What they call mucous membranes are where the virus can get in. So if you're not gonna if you're gonna go out and be among people, wearing a mask protects the biggest two mucous membranes that you have, the nose and the mouth. It's not a bad idea to wear some glasses too if you are choosing to absolutely not get vaccinated. And I just want to punch this again. What can you do that gets you a guarantee like this? I mean, this thing is protective. These vaccines do work. And we need everyone to participate in this behavior so that we can stamp this out as quickly as possible. So just another word of encouragement. Let me just say this. This is one of my heroes in medicine and one of my fraternity founders, but he quoted, made a quote specifically referencing sort of racism in medicine, but it still applies today, and not specifically to racism, but just a general kind of ethic around vaccine deliberation. What he said is, we in America have become frightened by ideologies. Our fears do not dissipate the realities of the problems that are at our doorstep. A functioning democracy able to weather any storm requires the facilities for a completely enlightened citizenry whose health is protected and safeguarded in every section of the nation, regardless of any distinguishing social factor. Could not be better said. Everything about this period of time is reflected in that comment. And this is obviously something that he published in 1949. So it's just a commentary on the issues that still linger with us. What he's advocating for is combating disease with education. And that's what I think all of us are here to do, to help you make a set of wise decisions that protect you and the people that you love. Here are some other resources. The CDC main website gives you sort of a data tracker function that allows you to keep up with daily developments as the CDC is gathering data from across the country and in and outside the United States. Also, I did a YouTube video with Dr. Kizzmekia Corbett, who is the African-American scientist who contributed or led the team really to generate the Moderna vaccine. And she and I did this for a local church here, but it's a great opportunity if you're still feeling a little bit uncomfortable about what the vaccine means for Black people. She's an African-American scientist, and I think she does a lot to explain the motivations that she had to be involved in the work. And it is not like the science came about in a month. If you listen to that, you will hear her describe a 6 to 10 month journey developing the science that ultimately came to be of great use in this particular time. So thank you for your attention, and I'll just pass it along to the next speaker.
Thank you so much, Dr. Hall. We really took a lot of education away from what you presented, especially how to stay protected, to protect ourselves, and for us to have knowledge that will help us make great decisions. Next up, we have Ms. Melissa Thunderberg. The floor is yours.
Hello, everyone. First, I want to thank Dr. Bird and Dr. Hall. I am Melissa Thunderberg. I am part of the Healthy Together initiative with NC Counts Coalition. And we are a team. I'm the operations manager over Region 3, which is Mecklenburg County in the lower region. What we came in to see what we could do to assure that vaccine equity was reached, because it showed where it was a gap between the Black and brown people, making sure that they had equal opportunity to vaccines. Now, what we look at is a lot of the data, and we say, okay, we see this area here, we have what we call hot zones. And in this hot zone, if we see that our Black and brown people are not getting vaccinated or the resources are not there, we go and make sure that the resources are there. We give the information so they can make informed decisions on real information. not misinformation, because our community has received so much misinformation that we're boots on the ground wanting to make sure that our communities get correct and true information. Another thing I want to mention too is the vaccine update on the Black and brown population. What we're seeing, when I looked at it, I was just really shocked because I work in the community, always working for social justice and equality. And when I seen the inequality in the rates of vaccinations between Black and brown communities and other communities, we knew we had to do something to make sure we got the information so our historical marginalized communities could have informed decisions when they make their decisions. So we are on the grounds. It's 6 regions. It's 2 individuals in each region. We're on the grounds getting the information. We let you know information that you may not know, where you can get your vaccines, how you can go about getting your vaccines, if you need transportation to get your vaccines. We also shut down some of the misinformation. Excuse me, Annette. We also shut down some of the misinformation. Many people do not realize that you do not need any ID. You do not need any ID to get vaccinated. You do not have to pay for any vaccine, the Pfizer, the Moderna, or the Johnson & Johnson. All the vaccines are free. You go, they're not going to want your ID. We don't give it's no information going to ICE or anywhere. All your information is protected by HIPAA the same way your medical records are protected. So that's what we want you to know. You don't need ID. You don't have to pay for it. If you need transportation, it's things in place to make sure you can get transportation. Another thing now, CDC, we know that, let's say you're on vacation at the beach and you see a vaccine drive and you go and you get that first Moderna or Pfizer vaccine shot. When it's time for your second shot, it doesn't mean you have to go back to the beach. You can still get that second shot. So just know that it's so much in place now to help make sure everything is easier for individuals to get shots. So as we're moving across the state of North Carolina, we're going to the communities, giving them the information. We want to make sure that the historical marginalized communities have the most updated, correct information so they can make a positive decision to help save lives and to help save your loved ones' lives so we can get back to having life together. Also, excuse me, also want to make sure you know that a lot of our immigrant community don't understand how to work with this online stuff. So it's also where we have healthcare workers, community healthcare workers in the field that will help navigate that. You don't need no ID or anything like that, and they will help you do that. So as we move across with Healthy Together, we're making sure that our communities get the correct information they need. And you get it from people that are from the communities. I'm from, some of them historical marginalized communities. Our team are from them communities. So we're going back to our communities, seeing what we can do to bring the information to our people. So just get your information and get it from a reliable source to make sure you can make the most positive informed decision. So you won't have to be hospitalized or die, or someone you love won't have to be hospitalized or die. Thank you.
Thank you so much, Ms. Funderburk, and giving us that information about how to access the vaccine. That's extremely important. Thank you. Our next panelist will be Major Timothy B. Peters.
All right. Good evening, everybody. Good evening to our distinguished panel, our guests, and also all the visitors that are tuning in via Facebook Live as well as YouTube. It's an honor to be here on this evening to talk about something that's very timely, relevant within our society for both our African American community, our people of color, and just our nation as a whole. As indicated on my bio, I am a major in the United States Army. So for this topic, not only does it hit for me from my service to this country to help and protect and serve the nation of this country, but more importantly, as an African American man. As Dr. Bird alluded to earlier today in her presentation, this goes back to the underrepresentation of us people as color that were denied the rights to have access to healthcare. When we talk about the Tuskegee syphilis and things like that, today we have the opportunity where we're exposed with opportunities and both exposure. Opportunity to have the right to be able to get this shot and get this vaccination. As alluded in the information and historical information and data that has been already captured, over 600,000 people have died. That's 600,000 people within this nation of all colors, background, creed, gender, race, and so forth that didn't have the opportunity to be able to afford it to take this vaccine. But we stand in the gap today with the opportunity to be able to take this shot today. And I think that's very important and prevalent within our community today. So why did I take the shot, right? So as I mentioned, I am a leader of this nation. So it's my obligation, it's my duty to ensure that I'm paying it forward to take this shot, because I have to protect not only myself, not only my fellow servicemen, not only if I deploy to abroad to help and protect this nation against all enemies, both foreign and domestic. So let's be transparent. I like to hang out. I like to travel with friends. I'm hoping that we get to go to homecoming this year. And I want to make sure that I'm doing my due diligence to ensure that I'm protected so I can help protect other people coming behind me. What's looking at on my bio, you will see that my previous background is coming from the Pentagon. So I'm here in Washington, D.C., where I served on the coronavirus task force. So when everyone in the world was teleworking and everything, unfortunately, I didn't have the luxury to be at home behind the screen. I had to go in every day from March last year when this kicked off, March 17th to be exact, to the present day, had to go into the Pentagon every day. Just like many Americans, I had no idea what was ahead of us. But at the end of the day, being able to see things from a different lens and a different perspective, to work with CDC, FEMA, White House, FBI, and all the other stakeholders that were involved in this and getting behind this initiative, I knew that I had an obligation. The military was very involved in this, such as going down to New York City to establish the Java Center. In addition to that, with the U.S. Comfort and Mercy naval ships that came to support and offset the supplements of healthcare workers within the New York and LA area that didn't have the bed space and the capacity to support. I also had the opportunity to look at this from a different lens on a procurement perspective with the M95s, the generators, and things like that. More importantly, from a military perspective, we activated our National Guardsmen, our mortuary affairs personnel, and other key leaders within our military formations to go help and support America, because at that time, America needed our assistance. And so for me to be on that platform to see things from that lens, it would have been naive for me or my family to not do our part within human civilization to not get this shot. And so for me, I took the Moderna. And I would just say, from a symptoms perspective, as the previous doctor stated, the first shot was just, numbness to the injection area. Now, I'll be completely transparent. The second shot took me out. When I say took me out, I felt lethargic. I was thirsty. But if I could be honest and transparent with everybody on the call today, I felt like I had a bad hangover. You know what I did? I took a good old Advil, took a bunch of water. I went to sleep, and I was back at work the next day. So that's just my experience. But as we know, everyone has different experience as it relates to the symptoms that they experience. But most importantly, it's the measures beyond those next 24 to 48 hours, knowing that you've done your civic duty and helped to protect this nation. And so in addition to that, why is this important? So from the military perspective, just like the rest of the nation, we have seen a spike in the number of people that have decided to get the vaccination. The military has an increase over 55% jump in the COVID vaccination over the past month. So with the force of about a 1.4 million personnel that are currently serving on active duty, we're currently now sitting at over 750,000 troops that are currently serving this nation against all enemies, both foreign and domestic, that have now got this shot. And so subsequently, that's their families as well that have also went and got these shots. So I think that's something very important to know. And as we continue to move forward, the advice that I would give our peers is we have an obligation. We have an obligation to not only pay it forward to ourselves, but we have an obligation to serve our community. And there's only one way to serve our community, and that's by getting vaccinated. Now, I know I have a lot of my personal friends that say, hey, man, I don't want to get this shot because I want to have kids later down the road. And if I get this shot, I don't know the different implications that may affect me later down the road. But I would tell you, and as we heard from the subject matter experts prior to me speaking on today, this is something that is going to benefit us. And we can't think about it from a short-term perspective. We have to look at the longevity and how we can continue to grow as a community, as the African-American community, as a people of color, and most importantly, as the nation as a whole. And it starts with us today. And so for me, I feel like there is an alarm at the gate. And so I commend, Wake Forest, the Maya Angelou Center, and all the personnel that are on this call today that's paying it forward to the community, because life is all about opportunities and exposure. And right here today, you have the opportunity to be exposed to scientific-based information and information that you can go tell your loved ones. So I encourage everyone to share this video at the conclusion of this. And if you have any questions, utilize the resources that have been provided to you today, and know that you can reach out to any one of us panel members, because at the end of the day, iron sharpens iron, and it takes a village, and it starts here with us today. Thank you for inviting me on today's panel.
Thank you so much, Major Peters, for sharing your perspective and looking at taking the vaccine as an opportunity to demonstrate leadership. That's an interesting perspective. Thank you so much. Our next panelist will be Ms. LaTanya Yarber.
Good evening, everyone. Thank you again to Takia Starks behind the scenes for inviting me, and I am honored to be on the panel to give my perspective. My perspective is I came in with hesitancy when the vaccine was, first being disseminated. I was not going to take it initially. I didn't even consider taking the vaccine. And I will say the hesitancy came from I studied political science in college, and I loved that my professor taught the history of American government from the bottom up. And so I became very aware of what Dr. Bird talked about, the Tuskegee, the Tuskegee case, Henrietta Lacks, that case of where they used her information unknowingly, and eugenics and everything. And so it definitely always left a bad taste in my mouth for the medical industry. And then also just how I've been treated. I have a son, and I will say that my treatment when I was having him was not great. And I know that for, people of color, and I'm learning even more Black women, we don't always get the proper care. And so I was just kind of looking at it like I can't really trust it. It's too soon. We're just not even a year into the pandemic. How can this really be effective? And then I'm young, and I want to be healthy for my son. I never got COVID. I got a lot of tests though, but I never got COVID. So I was like, I don't need the vaccine. I'll be fine. I want to be healthy for my son. I don't want to risk getting sick by taking the vaccine. That was more of my thoughts on it, initially going into it, because, we really don't know about the long-term effects if you don't see the long-term effects, because it was just starting out. So I never was fully against it, but I was just like, I'm going to wait. I'll let everyone else take it, and I'll just sit back a little bit. But as we got more and more into it, and I'm just being completely honest, I'm just seeing it more that the vaccine is being more socialized. So there is the who took the vaccine and who didn't take the vaccine. And as I'm navigating certain spaces, I'm just being asked, well, did you take the vaccine? And my answer is no. Why? And so I really, one day I really had to like ask myself, well, why are you not taking the vaccine? Because I work at the Maya Angelou Center, so I have the resources about the vaccine, and I joined the first COVID vaccine town hall that Dr. Bird gave, and so I paid attention to the scientific part. Now I don't fully understand the language all the time, but I did understand that the mRNA and I knew that it wasn't putting a chip in you and things like that. And also my family, like everybody in my family decided to take the vaccine for the most part. And so I finally just had to just really look at it from the perspective of doing my civic duty. Like Mr. Peters said, I was like, my one decision could affect, everyone around me. I don't really want to be in a setting where I'm the only one not vaccinated and I have to continue to wear my mask or possibly risk getting someone sick because I'm deciding not to get vaccinated. And that really helped me just move forward. And with my son, he's not old enough to get vaccinated yet, but he started going back to school and he really does not like to wear his mask. And he told me one day, he said, I can't breathe and it's hurting my ears. And I want him out of the mask and like free to run around and play. And so I was really like, well, you would want your son to take the vaccine so he can be free to enjoy a school day. So if you're comfortable with him taking it, you should take it as well. And so that changed my mind, more just wanting to freely navigate the spaces. I'm young, I like to go out, I like to travel. And it just makes it easier to go out to restaurants, to get on an airplane. You still have to wear your mask, but I just feel a level of protection now that I've gotten vaccinated. Now, I do have a lot of young friends who are absolutely not getting vaccinated. I don't know I don't know how to convince them to take it other than just why I decided to do it. So maybe you all can give me some more advice on how I could talk to my friend group, because a lot of them are not going to get vaccinated. I would like them to, but I do understand their hesitancy because it's hard to understand the language when you're not a doctor or that's not your field of interest.
Thank you so much, Ms. Yarber, and I really appreciate you taking us through some of your decision-making process. That's really helpful. Thank you so much. And last but certainly not least, we have Honesty Gainey, and we'd like you to take the floor.
Good evening, everyone. Just a little bit about myself that was already stated. I'm a recent graduate from Winston-Salem State University with a degree in biology. And I'm currently at a community college training to be an EMT. And my perspective, and I also want to thank Ms. Starks as well for inviting me on the panel as well. But my perspective on the vaccine, I haven't had COVID and I haven't took the vaccine yet, but with me completing my EMT certification soon, I know I'm going to have to take it. I can't go around it, especially with even after with future goals of me wanting to go into the medical field. I know it's not something I'll be able to go around. But a lot of what our last panelist said, I'm really in agreement with a few things, with just being hesitant with, side effects, hearing like different things on the news. With the heart inflammation, I think that was one of the recent things I've heard, and just being uneasy about different things that's come about, during the pandemic, and just hearing so many different people's experiences with the vaccine and COVID. And I guess me not being educated or attending a town hall that provides me with, the science behind it and, more information that I'm not getting, from the news or, family members and friends, which has opened my mind more, I guess, to getting it, which I know I probably will get it soon. Like I said, with me wanting to be an EMT and going into the medical field eventually. But overall, before attending the town hall and getting all this good information about it, I guess with seeing, you know, how people reacted from it, and I've never been like sick and I haven't had COVID, and I guess just being like, you know, what's going to happen to me, you know, what side effects am I going to feel, or long-term effects, definitely. Like, you know, we haven't seen, you know, long-term effect, like, you know, years of people having the vaccine, like what's going to happen. So I guess all of those things kind of like, you know, had my mind just kind of hesitant and not really knowing, you know, should I take it? Should I not take it? But this panel has really shown me, and with the presentations, you know, that it has good effects, especially with all three vaccines that they're giving. And I know I will take it. I guess I'm just hoping that I won't have serious side effects like the muscle pains or the fatigue. I guess I just want to be, you know, healthy, because I haven't gotten like, you know, any real sick illness like since I'm, you know, kind of younger. But very great information on the panel, and it's definitely making me more comfortable with getting it soon. And yes, thank you for having me and letting me share my perspective.
Thank you so much, Ms. Gainey, for sharing your concerns and your thought process around around the vaccine, and highlighting the need for more information for a lot of people who are undecided. Okay, so for our question and answer session, it's my pleasure to turn the program over to Mr. Alan Younger of Forsyth Tech.
Thank you very much, Dr. Caban-Holt, and I wanted to thank all of the panelists for the wonderful job that you all did. I'm Alan Younger, and I'm a member of the Social Justice Committee of the Alpha Pi Lambda chapter of Alpha Phi Alpha Fraternity Incorporated, and I'm very glad to have been working with the Community Leadership Council that's being facilitated by the Maya Angelou Center for Health Equity since last June. And I've learned a lot myself, and I continue to learn, so thank you all for sharing. We have a number of really good questions, and because Dr. Hall, who's my frat brother, and I love the number 7, we're going to see if we can get through at least 7 of these questions. The first question is, I heard the vaccine is not FDA approved. Is that true? If it is approved, then why should, if it is not approved, then why should I take the vaccine? Whoever would like to jump on that question, please do. And then, like I said, we've got at least 6 more to follow.
It is approved. All 3 have received emergency use authorization, which means that the federal government reviewed the science in all of the clinical trials where the vaccines were tested, and they approved the vaccines for that single indication, which was vaccination against COVID disease or SARS-CoV-2 infection, and they approved it quickly so that it could get out into use by the public. The fact that it went fast is only reflective of the degree of urgency. It's not about cutting corners and deciding, well, maybe we'll just take this little bit of risk because we need to get something out there and start making some money. There was nothing like that. It was all about public safety and about how quickly we could get some sort of help to the general public.
Well, thank you so much for clearing up that confusion. My next question is, how do we find out about the variants, the Delta variant, and what are the infection rates? How do we find that information out? In particular, with regard to our local community.
You can always, there are several websites. I think Dr. Hall put up some websites tonight, but if you don't remember those or if you didn't catch those, you can always go to the CDC, the Centers for Disease Control. Just type in CDC and type in variants in your browser. You can also go to, just type in, COVID from the National Institutes of Health or the North Carolina Department of Health and Human Services, all of these are reputable, credible sources, and that's where I would go. I would not depend on Facebook and all of the social media out there. There's so much misinformation out there. That's why many people haven't been vaccinated, because they've seen so many pieces of information that are not true. So I would stick with the CDC, the North Carolina Department of Health and Human Services, or whatever state. If there are people in the audience tonight who are from other states, go to your Department of Health and Human Services or Health Department or the National Institutes of Health. I would stick with those.
Thank you. It's very important to clear up the confusion, so I'm glad you just did. So another question related to the Delta variant. I read that people who are fully vaccinated are at least 88% protected against the Delta variant. Is that true?
I don't know what the percentage is, I'm sorry to say, but we are protected. There's a lot of, I know that we're well protected as with regard to the current vaccines. And I'm not sure what that percentage is. That's something we probably need to find out. But the existing vaccines are very effective against all of the new variants. So you're in good shape if you get the vaccine, even if you have that Delta variant out there in the community.
Okay, great. Thank you.
Just to add one comment to that, what you're going to see come out in the news as the individual companies start testing the efficacy of their vaccine product, whether it's Moderna, Pfizer, Johnson & Johnson, Novavax, whatever, as they start testing those vaccines against the different strains of the virus that are circulating, are estimates of how well they do to protect you. So I believe what you're referencing is Pfizer's data, but Pfizer and Moderna have more or less performed identically for all intents and purposes. So it's probably the same for Moderna. And I would say the same about Johnson & Johnson, even though it's one shot and the immunity tends to build over time. They're all going to more or less protect you. So that slide that I showed you that says it'll prevent you from dying, that is it. The main thing about the Delta variant, it originated in India, as far as we know. It's got 2 mutations instead of 1. The reason why it was able to do that in that population is because they are all in close quarters. They do not have a vaccination rollout opportunity like we have in the United States. And so the virus just circulates and circulates and circulates. It encounters more immune systems, it learns, and it changes based on what it learns. Yep. So that's why that thing came out of India stronger. Think of it in that way. And so you don't want that coming here. For people who aren't vaccinated here, they are as vulnerable as people who live in India if they are circulating among other people who might have come in contact with it. Dr. Fauci predicts that that's going to be the dominant strain because it is so good at moving between people within the next few weeks in the United States.
I really like the way Dr. Hall put that. I mean, it's really great to have a clinician on board tonight. But the virus doesn't really like surfaces. It likes human beings, and it likes to change. It likes to evade or get around our immune system. So it doesn't do the virus any good to be in a situation where there are just few people, hanging around unvaccinated. It likes to get around our immune system. So the longer it hangs around, the more it's going to change and the more deadly it's going to be, because its job is to get around our immune system, what protects us. So it's an amazing thing.
Well, thank you both very much. Let me ask another question that speaks specifically to the title of this town hall. And that is, what are institutions doing to address the reasons why we as African Americans mistrust the vaccine?
Yes.
So, I'm sorry, you asked the young people.
I wanted to speak to that. With Healthy Together, African Americans have this mistrust, and they have reasons to have this mistrust. So what Healthy Together are doing, they're sending people like myself that my community know they can trust to be the messengers. I have a long stance in the community. I fight for social justice and equality. So we're going into the communities to talk to our communities. We're sending people into the communities that you trust. It's easier to get a message from someone that you trust than people that you don't trust.
Absolutely. Thank you very much.
Mm-hmm.
Travel with family and friends is big on many people's agenda this summer. How can we do it safely, and what are some of your suggestions?
Well, there are many guidelines out there for travel. And again, that's something we want to go to the CDC or to those same places. But on a personal note, outside of maybe being attacked on one of these planes, what we want to do is exactly what Dr. Hall said. We want to continue to wear our mask if we're in these tight because we don't really know who's on a plane, for an example. We don't know who has been vaccinated and who has not. So we want to protect ourselves. We want to keep our hands clean, keep our distance, keep our masks on. But for those of us who've been vaccinated, I mean, we're in great shape, actually. And even the CDC says in quarters that, or inside, we can actually take our mask off when there are other people if we're fully vaccinated. But we want to make sure that we're fully vaccinated. I have to do some travel this summer, and I'm going to get on a plane, and I'm certainly going to put my mask on, even though I've been fully vaccinated. And as long as these variants are out there, I'll probably continue to do that. I'll probably keep my distance, wear my mask, make sure I'm not touching those little trays on the plane and all that stuff.
Yeah, I would agree. I would just say, keep in mind that we are running these experiments, kind of understanding how well the vaccines protect us while we're using them. So it's not like we have the entire catalog of information available to us, and then we're making decisions based on that. We're learning as we go. So there is a potential even among the best performers to get breakthrough infection. So you could get the vaccine. And by the way, fully vaccinated means 2 weeks after the first shot of Johnson & Johnson or 2 weeks after the second shot of either Moderna or Pfizer. That extra 2 weeks counts in terms of your immune system building itself to give you the full benefits of protection. So that's what full protection means. But even with that, there is a potential for breakthrough infection. And so you still have to be cautious. Same rules apply. Wash your hands. When you can't wash your hands, use hand sanitizer. Give yourself room to distance. Some of that will be imposed. Other times it'll be your choice. Wear your mask, eye protection if you can, particularly if you're on planes or confined places, traveling distances to go on vacation or what have you. But, try to be as conscientious as you have been, recognizing what freedoms you've gained by going ahead and getting vaccinated.
Thank you very much. So another question makes me think about some of the things that let's because she's a parent. So how can parents learn more about how the vaccine affects small children?
So studies in small children have not fully taken hold yet. I don't think we're going to get all the trial data from the first wave of that information coming in until probably sometime towards the end of the summer. They may even be enrolling now. I have to say that I haven't kept up with the pediatric study cohort as much as the older adults. I was really interested in what it would do with kids that were 15 and up, and it did fantastically well. 12 to 15, there's promising results in these populations as well. So I would imagine that with the youngest among us, there'll probably be some dosing adjustments, whether it's reduced dose or, one shot versus two. I don't know what the final situation will be, probably a reduced dose. But nonetheless, when we get that information, and if I can get my kids into the trial, I am ushering them off to get that vaccine, because I don't see any benefit in waiting to find out. They're going to be just fine. Keep in mind too, for pregnant women, you are carrying a life. To get COVID infection and be pregnant is a terrible thing. It's not just about terminating the pregnancy, it is the harm that it can do to the mother. Please keep in mind that there is a real choice to make around whether or not you get the vaccine if you're a mother. And the American College of Obstetrics hasn't really changed their recommendation, which is to speak with your provider about it, the person who's giving you your OBGYN care, and weigh the risks. But if you are pregnant and you get COVID, it can be catastrophic. So my advice would be to take it.
Thank you for that. There's a question that came in that asks, I'm not confident of taking the Johnson & Johnson booster shot if necessary. Can I take a different booster vaccine than the original vaccine?
That is not recommended as of right now, based on everything I have read. It's better if we have to take a booster as of right now. It's better to take the same one.
Okay.
Right. And just to be clear, Johnson & Johnson is a single shot vaccine. Pfizer and Moderna are the 2-shot regimens. And, if you want to take one versus the other, again, the same benefits accrue. So,
and right now, we don't know if we'll have to take a booster of any other than the two for Moderna and Pfizer. We don't know if down the road we'll have to take a booster, which is something that we're hearing in the news.
The likelihood of having to take a booster depends on how long this drags out.
That's right.
How many different strains of the virus can develop over the course of time, while those who have been vaccinated are waiting on others who are still deciding. The virus is not waiting on anything, and it is changing and adapting to what it's seeing. So as strong as the immune systems are of those who have gotten the vaccine, what new ability they have to protect themselves, if this virus lingers long enough, it'll figure out a way to get around that. And that is why it is so important for you guys who are still struggling with the idea to get on board, take the vaccine, just like you do for anything else. You've been to school and they've asked you for your shot records. This is that type of shot. It is not some special kryptonite, tracking device camera. It is just a vaccine. So it protects us all. Once we get ourselves protected, we can start reaching out globally, which is our responsibility since we have so many good resources, and we can stamp this out if we work together and do it.
Thank you. I'm going to ask one more question, and then I'm going to hand it back over to you, Dr. Caban-Holt. In some states, there are monetary incentives to taking the vaccine. Is this a good approach?
I guess it depends upon whether or not you get the monetary award, and especially in this state as well. I mean, one of the things that we're finding out in just recent weeks is that North Carolina is doing that as well. My thing is, whatever it takes. I mean, if that's what it takes for you, we're hoping that it will not take that for most people because there's not enough money to go around. But if that's what it takes, it seems to be working in some places. I personally don't have an issue with it, but my hope is that people will go ahead and get the vaccination without it.
So if I may, so in the military, one of the things that the Chief of Staff of the Army located at the Pentagon did as an incentive was if we reached a certain threshold in the number of troops, that were vaccinated by 4th of July, it was going to authorize for us to have no shaving, meaning that males in the military could go without shaving for X amount of time. So for many guys like myself, I'm like, hey, 4th of July, I want to go look like a civilian out partying with my friends. Hey, let me go ahead and get that shot. So I think depending on the circumstances and the situation, it's definitely an incentive to be had.
If I can chime in, when I saw I saw that, I didn't like it. I don't really think kind of offering a monetary incentive is always good, because I think it can cause some people to mistrust even more, because they're like, oh, and now you're trying to pay me to do something I don't want to do. So I don't know. I guess I don't know how they're approaching it, but I think some people could take it as, oh, now they're just trying to pay us to do something that we don't want to do. And so I'm not sure.
In the absence of an overwhelming feeling of civic responsibility, you just do whatever you can. But we're trying to get people to feel civically responsible for your neighbor. That's the real intention. So.
And I agree. And I think, to that point, we didn't have a problem taking those stimulus checks. You know what I'm saying? And that was informed as well to this nation. So I think, to each his own. But I think when we look at it from a holistic perspective, if we're going to incentivize, one sin is not good, and however you want to internalize that. But I think, when the Department of Defense, the President, and the administration pushed out many of those stimulus packages, we saw all the different memes going through social media, people excited and everything else. So I feel like this is no different.
Well, I want to thank you all a lot. I mean, there were so many questions that we couldn't get to. I'm glad that so many people are engaged. Now I'm happy to hand it over to actually Dr. Bird for closing remarks.
All right. Well, Alan, thank you so much. I am just thrilled tonight first of all, to meet Dr. Hall. Heard a lot about him, and to all of our panelists, LaTanya, I know you, Major Peters, and Ms. Funderburg, and Ms. Galney. We're just delighted to have such a wonderful panel tonight, and the participation of everybody. And we certainly thank everybody who has sent in questions. We hope we can respond to some of them in some other way. But we're just delighted. This is actually in response to Alan's group, our council who works with us, COVID Research Leadership Council. And so we're very excited that they came up with this idea and asked us to help put it on. We want people to know about this vaccine and the benefits of taking it. And we want our people to be healthier. And if this is the thing right now, as far as we know, these are safe vaccines. And as Dr. Hall says, we've got to stamp this out. Ms. Funderburg says we have all kinds of opportunities that the state has put in place to make sure that people are able to get the vaccine. So we need to take advantage of that. We just have the responsibility to pay it forward and to look out for each other as a community, as communities of color, particularly, to go ahead and take this vaccine and stop this virus from spreading and wreaking havoc on our community. So thank you all very much. We certainly will do this as much as we can. Good night.
Thank you, Dr. Bird.
Thank you.